Okay, thanks everybody. Everybody can hear me? All right, well, welcome, or thank you for having me. I hope you've all had a very good day and very informational and also inspirational. I can say that I had goosebumps when Richard was telling his story, so thank you for sharing that. So I do have the honor of being the very last speaker for today, so just hang in there. You've got one more talk to go through, and then, then it's your own time. I'll be warning you in advance that I will be asking you to do or participate in a few of the exercises that I have my group participants participate in, so just consider yourselves forewarned. How do I advance the slides on the top screen? Oh, the big play button. Okay. Oh, and I just want to also introduce Dr. Greg Tachuk is my colleague. He works at the Pan Am Pain Management Center, so we work very closely together in providing these kinds of services, both to individuals and to groups. So what I'd like to go over today is just talk a little bit about why we like to adapt a biopsychosocial model of chronic pain and what that means. To introduce a newer form of cognitive behavior therapy. So cognitive behavior therapy is a quite established psychological approach to dealing with emotional, physical, and other kinds of difficulties. But we've adapted a newer kind of this called acceptance and commitment therapy. So you can even think about what that might mean. And I do want to present some initial outcomes of a group that we've been running for the past 3 years. And then just give you a little bit of information about something that's yet to come. Okay, so why a biopsychosocial understanding? Well, first of all, we have seen pain in the absence of injury or in the absence of pathology. And I think the most extreme example of this is if any of you have ever heard about phantom limb pain. So phantom limb pain is somebody who's experiencing pain in a part of their body that's either been amputated or they don't even have anymore. So it's, I don't even have an arm anymore and I feel pain in my arm. So there's something more than just a physical phenomenon going on there. We also see injury in the absence of pain. So think about perhaps an athlete in a big event, and the athlete can break their ankle or break their leg, and they finish the whole game, and they don't even feel any pain until after the game is done. You also can think about the heroic feats that people in distress have performed, like people in military, etc. We also know that within people with chronic pain, there's variable success in neurosurgical procedures or in analgesic agents. And we know that for many people, two people with the exact same condition take the exact same medications and have various results. So another kind of indication that it's not all just, about the body. And again, a modest association between pathology and disability. And one of the examples of that is they've done studies where radiologists have examined MRIs for the backs of people who have back pain versus no back pain, and they couldn't tell the difference between the MRIs of those two groups of people. So what do we mean by the biopsychosocial model? Well, first of all, when we are have a pain experience, there's some predispositional factors. So that might be genetic factors or early environments, early childhood environments. And then there's the actual injury or what is physically wrong with the tissue or with the part of the body. And then there's what we call central sensitization, and that's just a very fancy word to describe nerves that are more sensitized. It's just that the body, it's like the pain alarm is really overdoing it. A little bit like if you've got a fire alarm in your house and your fire alarm goes off every time you make toast, right? So it's there, but it's not necessarily because of physical injury. Behavioral factors, what we do about living in pain. Social factors, social support or isolation, those kinds of things. Cultural or spiritual factors, so how our culture or spiritual beliefs identify or think about pain. And then psychological factors, so how we talk about pain. So all of these factors impact our pain experience and our functional outcomes. And as we can imagine, in any of these areas, there's certain things that are within our control and other things that are beyond our control, both in the immediate present and in the long term. And because of this huge variability of what is within our control at any given moment, it can be really useful to remind ourselves of the Serenity Creed, which I'm using more and more in my practice when I'm talking to people. And so just to remind you, that is, grant me the serenity to accept the things I can't change, the courage to change the things I can, and the wisdom to know the difference. And this is where acceptance and commitment therapy comes from, right? If we think about it, it means accepting what's beyond our control, and then committing to doing what matters to us, to doing what we can to build a life that has meaning. Some of the philosophical assumptions behind this new kind of movement is that human suffering is inevitable, right? If we're alive, we will suffer. We'll suffer losses, we'll suffer setbacks, loss of relationships, loss of jobs. That's just part of being alive, is we'll experience pain in this lifetime of some kind: physical pain, emotional pain, spiritual pain. However, our culture in the West, we have this general aversion to all of these present moment experiences that might be unpleasant, but are really inevitable and necessary, right? So we hear these messages: just think positive, don't be sad, everything has to be really good in our lives. And so we miss out on a lot of kind of the richness of life by trying to, push away anything that might be unpleasant. We've just lost a job and we're feeling sad. Well, no, pull up your bootstraps and just kind of think positive. And, so it's not necessarily helpful in terms of living a full life. Also, again, Western culture, we tend to approach the human body in kind of a mechanistic perspective, right? So if it's broke, then fix it. And that mind-body connection can sometimes be minimized in Western culture, Western medicine. And then again, chronic pain is inevitable when it's there. We don't have direct control over what our experience is in any moment. And pain flare-ups can be adaptive, right? They can give us some important messages. A pain flare-up can let us know that there's something that we may be doing that might not be quite right, or maybe we need to change something or examine something. And then it's about what we do about these messages. Do we listen to those messages, or do we get angry and fight against them and just push through? And here's an example of somebody who didn't quite listen to the message of their flare-ups. And this person says, I can quit anytime I want. So the overall aim of ACT, and we call acceptance and commitment therapy ACT because it is a very ACT-oriented, so it's about action, is to provide people tools and strategies to do what matters to them, to live a valued life. And we believe the key to that is what we call psychological flexibility, and that is that we live in the present, we are open to our experiences, and we do what matters. So we achieve this psychological flexibility through paying attention to 6 very interrelated but distinct processes, let's say. These are skills or tools or ways to help us live this values life. And when we do this a lot with what we call experiential exercises, which means using metaphors, using exercises, using meditation, so that we're kind of connecting with it on a more personal level, not just kind of thinking cerebrally or keeping it in our heads, but really experiencing it. So the first one that we look at is, again, that acceptance, and that's just a willingness for what's in the present moment. I can be with what is right now. And then we look at what our values are, right? Identifying and reconnecting with what is the most important for us. What really drives me to live my life. Diffusion is a little bit more tricky, but if you think about it, oftentimes our minds will tell us these things that are very unhelpful. So they'll tell us, you can't do this, I can't believe this is happening, all these unhelpful messages. And sometimes we give our minds too much credit and we, let's say, fuse with these ideas, right? So we could become one with what our mind is telling us. And so diffusion is just creating some distance between those unhelpful messages. I should know how to do this better. I shouldn't have done this. All of these unhelpful messages our mind tells us. If we can gain some distance from those messages, and we can decrease their impact on what we do. The next thing is to make contact with the present moment, and that's with mindfulness exercises, right? So it's awareness of what's going on in the present moment, either with ourselves, with our environment, both in more of the, let's say, formal exercises, but also in everyday life, right? Eating mindfully means paying attention to the food that we're eating. Walking mindfully means being present when we are walking, when we're doing anything that we're doing on a day-to-day basis. And then the self as context is basically connecting with a bigger sense of ourselves. I'm bigger than my pain. I'm bigger than my thoughts. Some people call it the observer self. People with spiritual or religious tendencies might call it the spirit or the soul, right? And that's a part of me that's more than just what my mind is telling me, what my thoughts are telling me, what I'm feeling. Committed action is sort of the crux of this all, right? This is the kind of end result that we want, is living a life that's in accordance to our values. And so we think about the two parts that are the acceptance and committed action are sort of the two goals, in a way, of this whole movement, and then everything else kind of helps us to achieve that. So what I want to do with you now is one of the experiential exercises that we do when we talk about acceptance. And so this is called Tug of War with a Pain Monster. So what I invite you all to do is just, if you're comfortable, just kind of sit comfortably, close your eyes if you're comfortable doing so. Take a few breaths. And now just imagine a bottomless pit with you on one side and a monster we will call pain on the other. You are both holding one end of a rope and you're engaged in a tug of war. You pull and pull and pull to avoid being pulled into the pit, but so does pain. Sometimes you get the monster a bit closer to the edge, and then pain pulls back even harder, and suddenly you are closer to the edge again. You can't seem to win. It may seem like you've been fighting a tug of war with a pain monster, pulling at one end of the rope and you pulling at the other end. Yet no matter how hard you've pulled to defend the pain monster, it always comes back stronger, pulling even harder. It may look like there's nothing else you can do while you're engaged in this sort of battle. You've got both hands firmly clenching the rope. Your feet are dug in, stuck in the same position. Back and forth it goes. And as this battle plays out, you're getting more and more worked up. Your chest tightens, your breathing becomes shallow, your teeth are clenched, your face is red with pearls of sweat welling up on your brow and forehead, and you can see the whites of your knuckles. Your hands are not moving, and your feet are not going anywhere. You're stuck in an endless and exhausting fight for your life. Or so it seems. Your options may appear limited in this situation. Your mind may have suggested that you pull harder, try harder, dig in more. Yet, isn't this all of the same? This battle with the pain monster? But we do have other options. What else could you do in this situation? What else would folks do if they're stuck in this endless tug of war? Right? If you're picturing that. What about dropping the rope? Right? What happens to the pain monster if we drop the rope? It's still there. It'll still taunt us to pick up that rope again. But what happens to our hands and our feet when we drop the rope? Right? They become free again. If we're thinking about ourselves in this tug of war and we've got friends, family members on the sidelines, we can't even see those friends and family. We can't engage with them. We can't do anything because we are so stuck on beating this pain monster, of winning this endless tug of war. So dropping the rope, ending the struggle, it creates an opening. It creates room to do something else in your life. If you're not consumed with reducing or controlling pain at all costs, right? This is This is doing those things that just don't work and that we do over and over again. If we keep saying, once I have no more pain, then I'll do this. Once I beat this pain monster, then I'll pay attention to my life around us. When we give up that fight, when we drop that rope, it gives us space and energy to attend to something you care about, those people watching and waiting on the sidelines. So dropping the rope and ending the struggle creates an opening and room to do something else in your life. If you aren't consumed with reducing and controlling pain, or avoiding painful thoughts, or emotional discomfort, because this pain monster really can be anything, right? It can be the anxiety monster, the depression monster, it can be anything that's sort of unwanted internally. Then you create a window of opportunity, you create space to move forward, to move toward the life that you've been putting on hold. Basically, when you drop the rope, you're free. So that's one of the exercises that we do with our groups. It's one that we do fairly early on, and it makes even more sense as you go on with the group. And all of these 6, if you remember it's called the hexaflex, it's the hexagon with the 6 processes. All of them, we have different exercises. So we have an exercise for values that I'll get into in a little bit. Cognitive diffusion, right? We separate ourselves from our thoughts. So one of the ways we can do this is by imagining our thoughts being put on leaves on a stream, right? And the leaves just go on, and we put our thoughts on these leaves and just see our thoughts come and go naturally. Contact with the present moment. I don't know if anybody here has done body scan meditation before. I know meditation mindfulness has become quite prevalent for good reason, because it can be a very, very helpful tool for living the life that we want. But the body scan meditation is basically pay attention to all the parts of our body and just allowing whatever's going on to happen, not trying to change anything, not trying to control anything, just kind of observing what's going on. Self as context. That's bigger self as self. So we think about ourselves as the sky, and our thoughts, our emotions, our feelings, our pain, they're the weather, right? So you can have the worst weather in the world, you can have the big storms, you can have thunder, you can have dark clouds, but the sky always has room for it. If we rise high up above, there's always that blue sky that's vast and endless and can hold any kind of weather system that comes their way. Committed action, we use the path up the mountain. So if you think about hiking up a mountain, it has all these different crazy parts to it, right? Sometimes it's these really crazy switchbacks and it feels like you're not going anywhere. Sometimes you have to go downhill for a bit. Sometimes you've got this nice, gentle path. And when we're kind of just paying attention to that part of the path, we may be thinking, things are really not going well. But when we give ourselves some distance and sort of see the whole mountain, we can see that wherever we are on that path is exactly where we need to be, right? That sometimes we're on this down, sometimes we're on this up, sometimes we're on a switchback, but that's okay because we're going in the right direction as long as we're going forward. I want to talk a little bit about values. I think that's really important to kind of think about what are values, and we do sometimes misunderstand what we mean by values. So values basically, they describe global qualities of ongoing behavior. So being hardworking, being supportive, being conscientious, being compassionate, right? And values are something that are always within our control. They're something that we can control, we can do. So it's not about, my value is that other people listen to me, or my value that other people are more helpful, but it's to ask for help or to communicate or to be supportive to other people. They have to be deeply personal, right? Values aren't about what we think society wants us to do, what we think other people will be happy about. It's about what really connects with us. What really drives us? What really makes us feel like we're alive when we're kind of doing this, when we're engaging in behaviors that reflect our values? They really create a sense of life meaning, purpose, and direction in our life, right? They're like our compass, really. They point us in the right direction. They keep us on track. And they're aspirational, which means that we can never achieve them, right? It's not a goal. A goal is something we can achieve. A value isn't. I can never stop being a supportive mother. I can never stop being, a caring psychologist. It's just something that I bring with me every day. And they can be very motivational. But of course, stuff gets in the way, right? There's a lot of barriers that we experience all of us being human, and especially when we are dealing with a chronic health condition and pain. And the first is struggling with symptoms, and that can mean, being stuck in that tug of war when we're struggling with symptoms, or when, our symptoms happen to be more intense than other times. So that gets in the way. When we set unrealistically high standards, right? Again, we hear these messages in society about if you're going to do something, do it well, and perfectionism is sort of esteemed. But on the other hand, we do have to be realistic, and we do have to set standards and do things to the best of our capability. Self-criticism, when we're hard on ourselves and we beat ourselves up, it doesn't help, right? It doesn't make us motivated. It doesn't make us want to do better. It just kind of brings us down. So intolerance of uncertainty, right? Life is uncertain. We don't know what's going to happen tomorrow. We don't know what's going to happen in a week, in a year. And so learning to embrace that uncertainty and just sort of live knowing that we don't know what's going on in the future. Over-responsibility for others, self-neglect. How many of us have kind of been guilty of that, right? Taking care of everybody else, making sure everybody else is fed, everybody else is doing okay, and then we come in last. And that's not good, right? That's not helpful. It's like if you're in an airplane and the airplane says, when the oxygen masks come down, put on your own oxygen mask on first before helping others. Need for approval, and this is like an overly need for approval, right? When we're always doing things because what will other people think? I want to make sure that I please other people, that, we can't really listen to our own compass because we're so involved and determined to just please everybody else in an excessive way. Guilt gets in the way, right? Overscheduling or procrastination, again, these things that we do. Fear and avoidance. And this is why when we think about practicing acceptance and mindfulness, that means becoming aware of when this stuff is coming up. And knowing that there's some things we can't control, right? We can't control if we feel guilt. We can't control if we feel fear. So we kind of say, feel the fear, feel the guilt, do it anyways. Because all we have control over is what we do. So feel the guilt about taking time for yourself, but do it anyways. And when we do notice these things, again, it's always doing it in a kind way, or even doing it in a humorous way when we're noticing that we're engaging in some of these, barriers, or when we're getting stuck in these barriers, or when they're preventing us from doing it. So what do we do when barriers do show up, right? Well, I'd say just allowing yourself to be the best you that you can be today. And that's all we can do. That's all we can ask from ourselves. When life kicks you or your deck of cards gets ugly, then thinking about what can I do today that will help even a little bit? Or saying it another way, what is the smallest, tiniest, teeniest step that I can take right now in the direction of my values? What's within my control right now? And one of the physicians that I follow on a blog, I find him very inspiring, and he was writing this shortly after his mother had passed away. And he says, our best efforts in life are dynamic, but that doesn't mean that they're not our best efforts. And then he goes on to say, and the fact that our best during difficult times might not be all that impressive when measured against our best during easy times doesn't make them any less worthy of pride. I'm just remembering that. And so I want to switch gears a little bit and talk a little bit about this group that we've been running. So we've been running ACT group since 2015. We've run about 8 groups since this time until we collected this data and sort of looked at what the outcomes were of the group. And now we're on our 10th group. What it is, it's 8 90-minute sessions every week, and then we have a 6-week and a 12-week follow-up to let people sort of live their lives a bit and then come back and reflect and sort of get a little bit of a boost. There's 7 to 10 participants per group, and at the time that we looked at the results of, so we asked them to fill out questionnaires before and after, and at 6 weeks and 12 weeks, and at the time that we were looking at all those results of those questionnaires, we had about 59 people. Just average age, just under 50 years old, mostly female, a lot of them married, most of them living in urban centers. And as you can see, most of them have been living in pain for quite a long time, right? The average is over 10 years of living with chronic pain. And so when we look at just pain scores, we found that pain scores went down by about 1 point on a 0 to 10 scale. So not like, they're pain-free or they don't have pain anymore, but there's a tiny little drop in pain scores. But I think what's more important is the other stuff that we found has changed in time. So pain disability is like how much pain is interfering with different domains of our lives, right? With our families, social, self-care, et cetera. And we found that, that kind of went down as time went on. The other thing is we measured depressive symptoms, and those are, feeling down, feeling depressed or hopeless, little interest or pleasure in doing things. That went down as people underwent the group and kind of continued on with their lives. Pain catastrophizing means thinking, well, I'll just give you a few examples of the questions on that scale. It's, I worry all the time about whether this pain will end. It's awful and I feel that it overwhelms me. I feel I can't stand it anymore. And so those scores went down. So people's relationship or their perception of their pain seemed to ease a bit with time. Pain acceptance. That's, for example, I'm getting on with the business of living no matter what my level of pain is. Right? Another question that we ask is, before I can make any serious plans, I have to get some control over my pain. And we reverse score there so that, the higher the score, the more pain acceptance. We found that there was a nice increase in how people accepted their pain, right? How they were wanting to live their lives even with pain. And then quality of life scores, increased as well. And I think that's probably one of our biggest goals, right? Is to have the best quality of life that we can. Physical quality of life is, in general, how would you rate your physical health? Mental quality of life, in general, how would you rate your mental health? And then I just realized there's one other little exercise I wanted to do with values with you guys, and we do have a couple minutes, so I think I'm gonna do this exercise anyways before we go, because we're almost done. So maybe once again, if you wanna just kind of sit comfortably, just take a few breaths, close your eyes if you're comfortable doing so. And this is called the 80th birthday exercise, and this is to kind of reconnect with our values. So imagine that you've just turned 80 years old. You've just had a really great party and everyone you wanted to be there has shown up, and it was a nice time, and now everybody's gone home. And you find yourself sitting in a chair. It's a beautiful sunny day. You're looking out onto a nice green space with a little pond. And you look back on your life and remember you're 80 and reflect on it. Now answer the 3 questions in your head, these 3 following questions. I spent too much time worrying about. So I'll just repeat the question. I spent too much time worrying about. I spent too little time doing things such as. So again, I spent too little time doing things such as. If I could go back in time, then what I would do differently is. If I could go back in time, then what I would do differently is. And so the good news is that for most of us, we do have time to kind of put into practice some of those things that we might have come up with. So again, these are kind of the exercises we use to help people connect with what's important for them, what matters in their lives. So what's coming up next is, we know that there's long wait times for services in terms of helping people live with their chronic pain and helping them, we say kind of change your relationship with your pain. And while waiting for services, oftentimes patients' health can decline. They might spend a lot of energy and time and money on different kinds of treatments that may or may not be helpful. And so Dr. Renee El-Gabalawi, who's actually the daughter of the Dr. Gabalawi that you guys heard this morning, her and myself, along with a team of physiotherapists, physical medicine specialists, and anesthesiologists, we've got a grant from the HSC Foundation, so thank you to the HSC Foundation, to develop a website where we're putting some of these things on it to help people access a little bit more easily some of these tools and strategies and exercises. And it's called Improving Access to Pain Interventions for Patients with Chronic Pain through a web-based program, Managing Pain Tools for Life. So we are in the development stage of that, and we're trying to make a website that's very interactive, easy to use, where it's not just reading a bunch of information. It's not informational, it's actually a kind of a more of a doing kind of website. And then we're going to be pilot testing it. So that's kind of coming up next in our journey. And I'm just going to close with this little fun cartoon. It says, the man says, "Instead of prescribing more drugs, why don't you help me discover what my values are and how to live my life in accordance with them?" And the therapist just says, "Whatever he's smoking, I want some." So thank you very much.